Hi, it's Annie. Welcome to my channel ANNYFREEDU, where I teach 3D anatomy. In this video, I'm going to talk about aspects and planes, and we will observe them on a 3D model as well as practice on CT scans. Let's begin. Because human body is a 3D object, we need to introduce other terminology to teach you anatomy, which we call planes. We are having three basic planes. The first plane that I want to discuss today we call a coronal plane, aka frontal plane, that divides body into anterior and posterior parts. I also need to explain why we call this a coronal plane. The skull is created by bones, obviously. And here we are having multiple bones. Right now, we are observing our skull from the anterior view. Now, this will be lateral view, posterior view, and superior view. From the superior view, we are seeing that this is a bone we call a frontal bone, and here we have two bones we call left and right parietal bones. Frontal bone creates a joint with the parietal bones that we call these joint frontal suture, aka coronal suture, because of its placement of corona, which means crown, hence the word coronation. So the plane that goes through this coronal suture and which divides body into anterior front and posterior back parts. So one more time, this is a coronal, aka frontal plane that goes through the coronal suture, which is between the frontal and two parietal bones. Another plane that I want to discuss is a sagittal or median plane. Median means in the middle, in the center. Sagittal, we can also call it a vertical plane. The sagittal plane divides body into right and left parts. And right now I want to explain why we call that a sagittal plane. So again, this is a superior view of a cranium, bones of this. Here we have two bones, left parietal bone and the right parietal bone. And in between, they create a joint which is not movable in adults. They're not supposed to be movable. Joint is called sagittal suture. And the plane that we are studying right now is called sagittal plane because it goes through the sagittal suture and divides body into right and left parts. So far, we know two planes. Coronal plane that divides body into anterior and posterior parts. We know a sagittal plane that's divides body into right and left parts. And the third plane, we are having transverse or horizontal plane. Transverse means actually horizontal. Once more, let me use 3D anatomy by Elsevier called Complete Anatomy and show you that abdominal region wall is created by these two muscles. We call these transversus abdominis, left side and on the right side. This muscle is called so because the fibers of the muscle is directed horizontally, transversely, and basically the name of this muscle tells me that a muscle that fibers is horizontal in the abdominal region. So we have frontal, aka coronal plane, sagittal plane, and transverse or horizontal plane, which actually divides body into superior and inferior parts. This is a human body in anatomical position. This is a vertical line, aka we can call a sagittal plane. And this red line is in the center, in the middle, so we are going to call that a median line or a plane. Median means in the center. We only have one median. Now, this is another vertical or sagittal plane that is a little bit off the center. So when we compare the red line with the blue line, we are going to say that red line is more medial closer to the center, which actually is a median, which is a center, and the blue line is more lateral. The word lateral means side, far from the center. If I bring another line, green line, we are going to call that a lateral, obviously, because compared to the green line, blue line is closer to the center. So we are going to call that a medial line, which means closer to the center. So one more time, we have only one median line that is in the center, but other lines in relation with each other, they can be either medial, closer to the center, or lateral, far from the center. For example, again, the blue line is lateral compared to the red line, but blue line is medial compared to the green line. So basically here we have a summary that we say that all our sagittal or vertical planes and lines, red is always a median middle plane. Blue and green both are sagittal planes, but blue is medial while green is lateral in relation when we compare blue and green. This is a brachial plexus. And in order to describe nerves, for example, in terms of the trunks, we are having superior, middle, and inferior trunk of the brachial plexus, and which divides into lateral, posterior, and medial. So medial means that it is closer to the center, while lateral is far from the center. And we call this posterior because when you compare the medial and lateral chords of the brachial plexus, this posterior part or posterior chord is really behind compared to the lateral and medial chords. And we also have a nerve that is a median nerve, and we call this a median nerve because it is in the center. So we are done with the planes. Now let's talk about aspects or views. When we talk about aspects and views, we imagine where are we standing when we are observing a body or a diagram. For example, if we talk about coronal plane, we can observe coronal plane from the front, which is anterior, or from the back, which is posterior aspect. If we talk about median or sagittal plane, we can observe this plane either from the left lateral aspect or from the right lateral aspect. And in terms of the transverse or horizontal plane, we can observe that either from the superior aspect or from the inferior aspect. So, we know planes and we know aspects. Each plane has two aspects. In total, because we have 3 planes, so we are going to have 6 aspects. This is a CT scan of a female patient, and what you are seeing here is 3 anatomical planes. Here we are having the transverse plane. In the center, we are having sagittal plane, and on the right side, we are having coronal plane. We understand this, but what we need to understand is where are we standing when we are observing each of the planes. Before we go there, let me tell you that this is a back side of a body and this is front side of a body. In the middle or in the sagittal plane, this part is anterior part and that one is a posterior part, back. On the coronal plane, we cannot see a back or front. We can only see that, oh, this is the right side and that one is a left side. On the transversal section, we can also see that this is a right side and that one is a left side. On the sagittal plane, we can also see that this is a superior part and this one is a inferior part. On coronal section, we can also see that this is superior part and this one is an inferior part. If this is a left side and this one is the right side, and we know that the heart is the apex of the heart directed to the left side, then what we are going to see that we can observe transversal plane either from the inferiorly or from the superiorly. Let's first of all check the aspect or view from inferiorly. which is this one here. Do you see there how the apex of the heart is directed on the left side? This is the left leg and this one is the right leg. But if we are going to observe a horizontal plane from superiorly, we are going to have a very different vision. Let me show you that. Posteriorly and then superiorly. In this case, well, obviously, heart stays to be directed, or the apex stays to be directed to the left side, but now this is the left of the horizontal plane, and that one is a right side of a horizontal plane. This transversal plane is observed from inferiorly because the apex or the heart is directed on the left side, and here we have the right side. So this will be a left lung and that will be a right lung. In this CT scan, lung or air is presented in a black color. As you can see here, outside of a body, that's a black color, which represents air. Or in the intestine, black space, that's air. Inside the intestine, the gas. On a CT scan, we always choose to observe horizontal plane inferiorly, so that this left side and right side, when we observe a patient, they stay on the left side and the right side. So this is how we are observing inferiorly our patient from the feet inferiorly. Now let's talk about the aspects of a sagittal plane. Because a sagittal plane divides body into right and left parts, I can observe the sagittal plane either from the left lateral view or right lateral view. That's it. This is comparatively easy. And here on this CT scan, because here we have a chin and this one is a front part and that one is a back part, this is observed by left lateral aspect. So this was observed by inferior aspect. This was left lateral aspect. Now let's move to the coronal section. Coronal section can be observable by anteriorly. So if you are standing anterior in front of the body, or posteriorly. This is it. But now, how to understand on a CT scan if we are looking either posteriorly or anteriorly? First of all, let's observe organs that we are having on a CT scan. Here you are. This is our coronal plane, and we know that this is a heart, the blood inside. That's a left side because the apex is directed on the left side. So this one is the right side. We also know that this is an organ we call a liver, and the liver is on the right side. So if this is a coronal plane and the apex is directed on the left side, so we are observing from the anterior aspect. But if this CT scan was observed from posteriorly, then the apex of the heart would have been here, or the liver would have been here. Anyways, or if somebody does not change a feature, we can surely say that transversal plane is always observed inferiorly, sagittal plane is always observed from the left lateral aspect, and coronal plane is always observed from the anterior view. And if you have some doubts, always look for the organs such as liver, heart, which we have unilateral organs. Now, unilateral organ means an organ that we have only on one side, such as heart, tilted more left side. For example, liver, which is more often on the right side. The example of bilateral organs, bi means two, lateral means side. So organs that we have on each side, right and left, such as kidneys, adrenal glands, or the lungs, they are bilateral organs. Okay, now this is a CT scan. Do you see the green lines? On the transversal plane, we have two green lines. This line can go anteriorly or it can go posteriorly. So this line presents coronal plane. This vertical line on the transversal plane represents sagittal plane because this plane, when it moves to the right side, the sagittal plane also moves towards the right side, or it moves to the center, or it can also move to the left side. Okay, so on each plane we have two lines, two vertical lines. On the sagittal plane, we are having two lines. The one line represents either it can go anteriorly or it can go posteriorly, so which also represents the coronal plane. On the sagittal plane, we have another line. It can go either superiorly or inferiorly, so that it represents transversal plane. On the coronal plane, we also have two vertical lines. We have two lines. This line that can go higher or lower, superiorly or inferiorly, also represent transversal plane. And this line that can go either on the right side or on the left side, it represents sagittal plane. I can move these two lines together. So for example, if I want to see vertebral column on sagittal as well as coronal plane, I will move these two lines here together. Sagittally, I can see vertebral column as well as on the coronal plane. I can see that too. Now let me show you something to confirm that this, for example, this transversal plane is viewed inferiorly, and we can see that because the apex of the heart is directed on the left side. Here on coronal plane, we can see that as well. If I show you a mirror image of this transversal plane, you will see that now the apex of the heart is directed in this side, so that this side stays left and that side stays right. Now this transversal plane observed from the superior aspect. In terms of the sagittal plane, we can see that this right now, the sagittal plane is observed from the lateral view. But if I show you a mirror image of this screenshot, you will see that now this is the sagittal plane is observed from the right lateral view, because the chin of this patient is directed to the opposite side. And for the coronal section, right now we are observing this patient from the anterior aspect, because here we have a heart which is on the left side, tilted the apex, and the liver is on the right side. So this is right side and that one is the left side. But if I show you an mirror image of this screenshot, you will see that now the apex of the heart is directly this way. So this is left side and that is right side where the liver lies. So this will be a posterior aspect of this CT scan. Well, I hope you enjoyed and understood everything. But if you have any questions or suggestions, please let me know in the comment section. Don't forget to check my TikTok or Instagram account where I upload short 3D videos daily. And thanks for watching, and I'll see you in the next one.